And we're back at it.
Let's go! It's been a while.
It's been a while. I miss this. I miss this music. And hey guys, for those of you watching, welcome to the episode 13, I think, of the CommoNurse podcast. I'm Sheila.
And I'm Ruel.
Oh, welcome to
The CommoNurse podcast.
Yay!
It's been a while. So, for
and
everyone,
What is saying hi already?
everyone that's been tuning in, like we've been away for a while, but we've been consistently posting
Yeah, true.
episodes anyway while we're on our holidays.
Where did we go to? You want to share with them?
We went to New Zealand.
That's great. And do you want to share with them a bit of our experience in there?
No.
Why?
It was expensive, guys. It was expensive.
Yeah, but overall, how would you rate the experience? I mean, just the vacation itself.
Well, it was a chill vacation because we didn't really have anything like
Planned out?
Yeah. Like there's no tours. Like we just had to figure it out when we got there,
Yeah.
which is actually like cheaper, I think, rather than booking heaps of tours and activities.
True.
Like we just made whatever activity we can fit in with the budget that we had.
Yeah. And mind you guys, we also like organized a little bit from here prior to us going there, but then like there's a couple of days that we haven't done anything, we didn't really book anything, so we just like went around and have a look, hey, and then we managed to go to the most like famous places there, I think, like the touristy ones, but we didn't try all the extreme ones. Someone's making their bed. Sorry.
What the? It's 10 o'clock in the morning. What are you doing?
It's almost 11, Daddy.
Anyway.
In dog hours. Okay.
Enough with that intro.
True.
Probably Sheila will include that in her vlog anyway, like the trip. So
Yes,
stay
I
tuned for that.
will.
Watch out.
Yes, watch out.
All right. What's our topic for this episode, Mako?
All right, guys. So today's topic is a bit of an interesting one. We are going to discuss how nurses behave when they become patients.
As patients.
As patients. So I think I'll start.
Go for it.
Okay, nurses sometimes can be difficult patients. I think
Sometimes.
this is a really common
Very
a common,
relatable issue.
and a really common thing. I think if you're listening, if you're a nurse and you're listening to this, you would agree with me that nurses can sometimes, or most of the time, can be difficult patients. Like, because we know what's happening. Like, the thing is, based on my experience, as if I'm the patient, I would be like a bit meticulous with the things that's been happening. For example, like it depends on my presentation. Sometimes it gets to a point that they question what's
I
the
hate
doctor
that.
clinically what the doctor is doing. You know what I mean? Because you know that it could have done better. Like it could have been done this way.
Yep.
Like,
Yep.
can you relate to that? Like,
definitely.
do you have any experience? Like,
Well,
of
going
that?
back overseas when I was still doing nursing in ED, there would times be where like someone comes in and then they're saying they're sick, and then straight away they'll say like, I'm a nurse. And then, oh, okay. And then that instantaneously creates that barrier between you and the patient, saying, oh, God, hey, can someone look after this? He said he's a nurse.
And it's quite intimidating.
Yeah,
isn't
yeah,
it?
yeah,
Like, very,
definitely.
very intimidating. Like, because you know that this patient is gonna like scrutinize everything that you do.
Everything you do.
Yeah. And there's also like, for me, it's when I first started, I would say that I'm scared to look after a patient, like if they're a nurse or if they're a doctor by profession.
Yep.
Like, because like, oh my God, is this patient gonna be happy with me? Are they gonna complain about it?
Yeah, that's the thing.
Yeah.
If they're gonna complain about it.
Yeah. But now I hopefully developed something that I'm not much intimidated by it. Do you want to add?
No, because I can
more?
still remember like when we're carrying out initial orders, like not carrying out, was starting like venipuncture and like collecting bloods, and
Yep.
then they'll scrutinize everything that you say. They'll be watching every bit,
Of the things that you
Yeah.
do.
Yeah.
Yeah, true. So
which is kind of annoying sometimes. And I often encounter this. I'm not generalizing all the new grads, but new nurses, like whenever they get admitted, especially with all the new knowledge still fresh in their mind, they just
Mm-hmm.
recently passed their board exam. They kind of have this pride that they
They're
know
a
what's
nurse.
happening. They're a nurse,
Yep.
so they'll start questioning you to test whether or not you know what you're doing.
Mm-hmm.
And then it's like, come on, stop it. You want to do it yourself, or you want to let me do it?
Did you at one point tell a patient
I
that?
think I did, yeah. Because in ED there was like group shout out to the Maldito boys in ED. If you show attitude to us,
Mm-hmm.
we kind of have this, I don't know, urge to show you back kindness in our
Kindness.
in our own little way. Like
Okay.
you could end up having a bigger IV cannula than what you should be getting,
Yep.
or you could have more multiple attempts.
Yeah. Well, but that shouldn't be happening. Okay. What's the next thing that you can remember? Like if when nurses become patient as a patient.
I don't know. I just know that they're difficult. Oh, we're difficult to do. I don't know, because
What else?
we just love asking. For example, I'm the patient, and then you start doing or giving me meds. I
Mm.
just want to know what's going on. It's not that I want to intimidate you. I'm
Mm.
just saying this on the other side of the spectrum, like me as a patient. Like
Yeah.
I don't want to be, as much as possible, I don't want to tell you that I'm a nurse. For example, remember
Mm.
when I got admitted here
Yeah.
in one of the
Yeah.
hospitals
True.
because of my gallstone issue?
Yep.
I was so discreet about it that I
We
wasn't.
were so discreet
Yeah, we were
about
so
it.
discreet. And it only came out when they realized, when they remembered that, hey, weren't you like a student here before? Aren't you a nurse? I was like,
It's because of me because
yeah. No,
they
like,
know me.
they know you,
I
and
don't know
and at the
why.
same time, I was a student in that ward before.
Yeah.
Yeah,
True.
and then
True.
you all of a sudden feel there's a change to how they do things around
Yeah.
you. I was like, just do you. Like I'm a patient.
Exactly.
Yeah, yeah. Don't be like threatened by the fact that I'm a nurse, because
Yeah.
just do you.
Um. Would
That's just me. I'm not saying
Yeah,
like
yeah. I
for everyone.
understand. So, secondly, would you think that nurses would be a bit entitled?
In a way, yeah, yeah. As I've told you, I've experienced it. Like,
Yeah, because one thing I noticed is that when, like, again, this is not generalizing to the newly renowned nurses, but then it's just because sometimes when they say that they're a nurse, they feel like they're entitled to a special treatment, and they can demand whatever they want,
mm,
like. Hey, are you not gonna do this? Are you not gonna do that? Are
mm.
you gonna give me this medication? And like
Isn't my
questioning
meds due
I know,
this time?
right? Like questioning everything that you do. I'm like, man, really? Like, cause like over time, you get this experience and you
Mm,
get this years of experience when you get to also um train yourself to be patient
mm,
with every patient. So technically, if you're looking after this patient who's a bit entitled because they're a nurse,
mm,
it's just sometimes, as what you said, you tend to actually make it a bit dragging for them.
mm,
Well, look again. I think this is a wrong idea or like a wrong response to it, but um, hopefully you won't give us a hard time because we are kind of sometimes giving you a hard time. But in a way, look, we're still looking after other patients, so
mm.
it's not basically like we're ignoring you.
Yeah.
If
We're
if it,
actually entrusting you that you know what's going on
yes.
to your condition,
Mm-hmm.
and there's more sickly or sicker
Yep.
people
Yes.
in the area that needs more attention, and
Exactly.
you can actually
And
contribute to the team even though you're a patient.
yeah, and
Mm.
I get that. Like just be more understanding. Like
Because you've
also
been there.
you've
If
been
you've been there.
exactly.
Yeah.
Yeah. Even though your experience is not in ED, but
Mm,
the fact that you know how hard it is we like us nurses work
mm,
in our day-to-day lives, it's actually like you just have to put yourself into our shoes.
mm.
Like even though you're a patient.
Like we expect you to be more understanding rather than implying that you need special attention because you're one of us,
Yeah.
basically.
True.
Yeah.
Apart from that, anything else?
Now, how do you deal with it though?
Okay. Now,
Like from
um,
your own opinion or your own perspective.
I just do me.
Mm.
So basically, I would still treat you as a normal patient.
Yeah.
It doesn't give me that special that I would give you that special attention because you're a nurse. No, I would still act like you're one of these patients, because it goes without saying, like, even though you don't tell me like I'm a nurse, so every patient is treated the same. Does that make sense?
Yeah.
Because it's like
I think that comes with experience
yeah,
though. Like
if you're like
I
you're
acknowledge,
maturing in a career,
I acknowledge that when you're still new, it is kind of intimidating looking after another nurse, especially again overseas. Whenever I get handed over a patient saying, "Oh, you be careful with this one because he's a nurse or he's a doctor," and then every time I go inside the room, I'd be shaking. I was like,
again, that's what happened with me as well when I was like.
I find it really
started.
intimidating, but now like after years of experience of doing this thing, you just kind of okay, whatever. He's a nurse, he's a doctor, he's a doctor. That's it. We'll still look after them the same way.
Yeah. And sometimes I tell them that as well during handover, because like there's also there's a need for us to hand over that they're a nurse. Like seriously, guys, it happens a lot of times. Most of the time,
it's the
to be
highlight
honest,
of the handover. Actually.
Yes, like hey, she's a nurse or she's an ex-nurse, she's a retired nurse. Do this and do that. I'm like, well, look, she's a patient now, so I'm gonna treat her as a patient. Okay,
exactly. That's a good one.
So that's how I deal with it. Like I don't give them special treatment just because they're a nurse. They just like they're one of the patients that needing my care. So that's it. How about you? How do you handle it?
No, but it just from my memory, I find doctors as patients more like conservative in a way, like they're more understanding if they're in that bed
true.
compared to nurses. I just don't know why, but I find it funny.
Well, that's what I'm saying. Like nurses are difficult patients. I don't know why. Well, I guess again, entitlement, like they're just being difficult. Anyway, so how do you handle
it? We're shitting in our own nest here.
Exactly.
But, at times we're guilty. Well, I'm not guilty because I'm not that kind of a patient.
Yeah, we'll go through that later. But because you already cited an example. But I want to go through that in the end. How do you handle it? Like
again, like I've mentioned earlier, like I've been doing this for a while. I'm just good in ignoring things.
Yeah,
like, couldn't care less.
It just really comes with what do you call this? Maturity, isn't it? Like as you gain experience. And also comes with confidence.
Yeah. Like regardless of what your profession is before you becoming a patient, you still won't be able to do things because you're the patient. Like you can't self-administer meds to your own self.
Yep. Yeah, true.
Do you want to risk your license doing it?
No.
It's like,
no.
Just be understanding.
Yep.
If it comes to a point where they'll give you attitude, look, you can subtly give it back in your own little way, but I don't encourage everyone doing it. As long as you can defend yourself, like go for it.
Just
as long as you're in the right, I think.
Exactly. I think just be firm with your clinical decisions, because at the end of the day, it's
that's
your
the word
call.
I'm trying to find. Just be firm.
Yeah, firm.
Yeah, as long as you know what you're doing and you're not putting that patient in danger.
Yep, exactly. And even if it's like late medications, guys, they're not gonna die because it's like a 15 minutes it's past the time that it's charted. So I guess you still have to be actually kind to nurses, kind to yourself as well as a nurse. That look, if they're questioning your clinical judgment, just be firm about it and just continue to do your work.
Doesn't mean that you're a nurse. You can't be educated
exactly
on what's happening.
Yeah, exactly. Anything in mind?
No, I guess if your patient is a nurse, I think it'll come to play that you're good in explaining things.
Yep.
And hoping that they're good in understanding because they're nurses.
Yep. Oh, sometimes you know what? I am
You would hope
actually.
that they would understand, given that
Yeah, well, that's the thing. I'm really hoping that they're more
considerate.
understanding
Yeah.
and more considerate about like what we do, and especially like when explaining things, you would think that they already understand.
Are you guilty of doing this though?
What do you
When
mean?
you're a patient,
What do you mean? Like,
like being intimidating.
no,
Are you sure?
no, no. I haven't been a patient. I mean,
You have been.
I have been, but I haven't been what do you call this? Like, I didn't tell anyone that I'm a
Mm.
nurse.
Okay. Yeah.
So we're going to the end of this topic, guys. But our recommendation is just be a chill nurse. So just what Ruel said, he cited an example when he got admitted, and same goes to with my experience as well, being a patient. So we didn't tell anyone that we're a nurse. We
Mm.
just let them do their job, because I feel like they would actually do the right thing if
Yeah.
they
Yeah.
they think that we're a patient, because you would really hope that they're doing that to all of their
Give them the
patients.
opportunity to do the right thing rather
Exactly.
than
Then in questioning
yeah.
everything.
Yeah. Okay, it
Yeah.
doesn't help.
It doesn't help. And it just develops like this scare factor
Mm.
that they like, oh, why does she know that? Why does she know this and that? And like,
Mm.
yeah, you're not really helping.
Yeah.
But we were just so chill. Like the moment that Ruel came to ED, we got a bed straight away. Everyone was so nice. Especially shout out to Ats. You know who you are. She actually looked after us very, very well.
Oh
So
yeah, that lady.
yeah,
Yep. Yeah.
yeah.
That
Um,
was even before you were working there, right?
yeah, yeah.
Yeah.
And then I get to work with her, which is
Mm.
like the same. She's a really nice and kind person. Shout out to Ads Astrid. Um, and also like she also accommodated us. Straight away gave us like the medication that you need for the pain.
Mm.
Although we waited for a long time, but we didn't make a fuss.
Yeah, yeah,
Like,
yeah.
because
Like I was in a
remember?
lot of pain at that time, but
Yeah.
like I just trusted them that they've given me the right thing.
Exactly.
Yeah,
No, and that's actually resolved your pain.
yeah.
Just straight away. I think just 5 of morphine
No, no, no. Remember, like,
and that blue.
no, no, no. It got infiltrated,
Yeah,
but
yeah.
then I didn't make a fuss out of it. Like,
Yeah,
as to why it happened. So,
yeah.
yeah, you just go for it.
Exactly.
Cannulate me in
It
other areas.
it happens,
Yeah,
and
yeah.
like especially if you're giving medication through the drip,
Mm.
it can be irritated, so it can happen.
Yeah.
So again,
That
just be
doesn't
chill.
necessarily mean they don't know what they're doing because something
Exactly.
wrong happened.
Yeah. Just be chill. Don't come out don't come out like a, oh, I'm a nurse. Like, don't give us that vibe, please, because it doesn't really work. It doesn't work for
Mm.
me. For me, anyway. How about you? Like, any more recommendations?
I still have stories to tell, actually.
Yeah. Okay. All right.
Just going back. When I also got admitted, most of my examples, guys, are from overseas.
Mhm.
I got admitted there. I was so discreet about everything, but then my mom shouted again, "Mama, just can't help but mention to
Everyone.
everyone that's working there that my son's a nurse." Blah blah blah. I was like,
Where was this? Is it the hospital we worked in, or was it a different
I
hospital?
think it was in a different hospital.
Okay,
Yeah.
and then
Oh,
what
I think I was still a student back then when she was there. It's like,
Oh my
oh
god.
my god,
That's so embarrassing, isn't it? Like, I'm
Yeah.
still working out to be a nurse, and then now you're telling everyone that
Like that's
I'm
not
gonna
even
be
a
nurse.
guarantee that I'll pass my boards and whatever.
Yeah, exactly. So like, you'll be a bit embarrassed.
It happens.
It happens. True.
Yeah.
And I guess it's like a coming from a proud moment for your mom. Like, hey, he's also studying to be you. And I get this a lot. Like, also there's some patients that would tell me like, hey, this is my son is also studying to be a nurse. And then, you know what, any advice? Like, they would ask me for advice. I'm like, okay. Just make sure that this is their passion. That's what I always say. That make sure
Yeah.
that they
Like-
give this their all, because it's a hard job. It's not for everyone.
Something in related to where we are now though. Like, is it more difficult, like as a migrant dealing with a nurse patient?
What do you mean? Like, if they become a patient?
Yeah, yeah. Like I mean, like you, like as a migrant nurse
Yeah.
dealing with like what how should I describe this now?
Like,
Like people from Australia
okay.
or like
Um,
people from different
background.
nations or background
Yeah.
ethnicity.
Um, no. I guess again,
Do you have this like intimidation
I
towards them
I
or
would say I won't lie. At
mm,
first I would.
yeah.
I would be. Um, but then again, confidence and years of
Yeah.
experience comes to play because like you've already worked as a nurse for a long, long time. You've actually developed along the way years of experience of how to manage this
Mm,
kind of people. And to think that you have an experience overseas and coming to Australia, you've been dealing with this a lot.
yeah.
So, yeah.
One thing that I've also appreciated in here though that it is acceptable not to know everything.
Mm-hmm. True.
Unlike compared to when we were still in the Philippines, like nursing is a very broad profession. It
Mm-hmm.
has a lot of fields.
Yep, yep.
And you're not expected to know everything. But
Mm-hmm.
back in the Philippines, it's kind of a shame if you can't answer anything related to your job, right? Unlike in here, they're quite open. It's like, I honestly don't know the answer to that, but I can look it up and get back to you. Like
Yeah,
that is an acceptable behavior in here.
yeah,
Like
and I
it's
find it so that
comforting as a professional that
exactly.
oh like oh that's good. Like they don't take that as like a
No,
minus to
yeah.
you personally, but instead like no, it's acceptable that you don't know
Yeah,
all of
true.
these things.
And you just have to be honest.
Yeah,
Like
yeah, exactly.
just tell them
Rather
like
than pretending that you know this
yeah.
thing.
Just tell them honestly like, hey, I actually don't know, but I can look it up and get back to you.
And you won't hear a
those
thing. Yeah, yeah.
yeah, those phrases I
You've been
as
used a
an
lot.
immigrant, I get to use that a lot because again, like it just says it all. Yeah, you don't have to like give them a false answer.
Yeah.
It just read
You're
between the lines.
acknowledging
That's
that,
it.
yeah,
Yeah,
you know.
yeah, yeah. And then when you get back to them, at least you can explain it.
Yeah.
Oh, this
And
is what
then
I gather.
to the guys that are listening, if you find this relatable, that when you're practicing nursing in the Philippines and then like this is quite common dealing with doctors
Mm-hmm.
and then they ask you something and then you can't give them an answer straight away and then
Mhm.
the doctor would just be so condescending and then say, oh, how come you don't know this? Like this is your job, right? You should know how to do this. Well, and you wouldn't even get the chance to defend yourself because you would just be bombarded
Exactly.
hearing stuff that you don't know this, you don't know this.
Yeah.
Like it kind of came out that you're incompetent. Why are you even here, right?
True.
Did you get that feeling when you were still overseas?
Yeah, definitely. A lot of times. And it made me cry a lot, guys. But it also, what doesn't kill you makes you stronger.
Oh, yeah, that's very
Yeah.
true.
So I'm glad I came out of that. But like one thing I noticed.
Hopefully, it has changed. now.
Hopefully. One thing I noticed the doctors here, they're very, very nice and very professional. If you don't know the answer, they'll be kind enough to explain it to you. Sometimes they would explain ECG readings to me that is beyond my scope.
Yeah.
And I feel like my brain is going to explode. But you know what? You just listen and smile.
Yeah,
Because at
and-
the end of the day, they're giving their best to actually explain things to you and just give it your all and focus and try to understand what they're saying. Because, yeah, they're just helping you.
yeah, that's
Yeah.
very true. We're gonna talk about that in a different episode.
Yep,
Anyway, we just kind of got sidetracked there, but for a little bit. But yeah, you got anything else to say?
No, I think that's it. Again, piece of advice: be chill, guys. If you're gonna be a nurse, if you're gonna be a patient, putting yourself into someone else's shoe
Yeah.
is really
Be
helpful.
understanding.
Be understanding. There you go. That's about it. It's a wrap for this topic. Yes. Happy?
I'm happy. It's quite relatable. So, again, guys, you can also feel free to share your experiences in the comment section, or
Yep.
you can send Sheila a message.
Yeah, true. Like tell us what you want to talk about and we'll be happy enough.
We
to
should start
actually-
including like whatever people are sharing to you though in one of our episodes.
True. Like the comments
Had
and all
anyone
that.
been messaging you?
Well, there's a lot of comments in
Yeah.
our podcast, so we should actually try
Again,
to read
nurses, be kind.
Yeah.
Especially if you become a patient.
them.
Um,
Exactly.
yeah.
Especially if you become a patient.
They sound
All right.
finished.
That's about it. I'm Sheila.
And I'm Roel, and again, this is the
CommoNurse
CommoNurse Podcast.
Podcast. Bye,
Bye.
guys.